the stage one redesigned by Dr. Simon Wong, the lower, some of my students have said that appliance in itself should get the Nobel Prize because the results on it are insane. And Dr. Wong has case after case after case. His cases are being looked at by the number one researcher in vertical growth in Texas A&M, and his results are insane in the lower arch. And he has case after case after case, and this is a consecutive sample, so it's not like he's taking out the bad cases. It's like every single case, it's in the sample. And when you look at that, you go, there's no reason why every single orthodontist on the planet should be using this appliance and expanding everybody's lower arch through this appliance that uses contact resorption, because it changes the whole morphology of the bone, and we can change our bone at any time in our life. So all you do is put pressure on one side, so the bone cells die on one side and they build on the other one. Just like if you break an arm in your 60s, it will still heal. So this appliance is fantastic, and the patients wear it. It's zero intrusive. You don't even know it's there. It's a fantastic appliance, and it frustrates me that every single orthodontist is not using it. Like my student in Spain, she said, this appliance should get the Nobel Prize, because when you start using it, you realize it changes everything. And I know Dr. Yusefian, and he should be using it. I'm going to talk to him and see. You need a good lab, and you need to understand what the instructions are to the patient, and the patient needs to follow the instructions. But if everything is done well, it is fantastic. And I urge you to learn more about the lower mu stage 1 as redesigned by Dr. Wong.
Sure. So how would you respond to a potential rebuttal to that, which is that if you use dentoalveolar expanders in adults, a lot of times what you get is tooth tipping, bone resorption, gum loss, root resorption. How is this different?
When you look at the photographs, you know that this is not dentoalveolar, because we use the plastic. The plastic goes down onto the bone. We do hold from the teeth, but really the resorption is, and you can see the horseshoe of bone changes. Mm-hmm. So this is not dentoalveolar. And the trick is to design the appliance well, because if you take a natural orthodontic appliance, it is dentoalveolar. But this appliance is based on the principles of dentures. So you eat with it. If you don't eat with the device, then it's not going to work. It's going to be dentoalveolar. But if you eat with it, then you're transferring all these mechanical forces into the bone to change the bone. So you got to understand the principles. Dr. Wong has so many courses, so many things online. Dr. Mew has books showing this, and his book, Causes and Cure of Malocclusion, is an amazing book. And he's looked at the biology. He understands the histology of the cells, the bone cells, and it's there. But we are comparing apples and oranges. Dentoalveolar orthodontic appliances are no good. This is not a dentoalveolar. It's a bone anchored device.
Mm-hmm. Mm-hmm. Yeah, we're huge fans of Dr. Wong on my channel. I think 2 or 3 weeks ago, I had a video demonstrating some of his 155 consecutive cases, and I have another one coming out soon. So, we're huge fans of his, and totally give him all the props and respect in the world. So I'd be interested to learn more about how this distinguishes itself from other tooth-borne expanders, which in my experience, in my own personal experience as a patient, but also the consensus that I've gathered from anecdotes from dozens and dozens of patients that I've spoken with, is that tooth-borne expanders, unless they're very carefully used or unless it's very carefully designed, are very limited and have the potential to do more harm than good. And in general, I've advised against them, but I'm open to learning more about this perhaps more refined version, or it might look like a tooth-borne expander, but it's actually not, as you're suggesting. So I'm eager to learn more about that.
Yeah, I mean, you said the key. It has to be carefully designed,
Mm.
And I don't know if you follow the 7 habits of highly successful people, but you have to have an end in mind. And then you also have to sharpen the saw. And we don't do that. If you just say, okay, I'm going to learn this really quickly and put it in because I have no time, it's not going to work. If you're going to do it, you need to sharpen the saw and make sure you learn and you understand. And it's frustrating for providers because there's no lab technicians that can make these appliances. Dr. Wong trained his own lab, and I don't have a clinical practice anymore because I don't have a lab. That's the reason I stopped, is because it was just too demanding on me. I didn't have a good lab, and that lab has to be impeccable. And the good labs, they will not work with you because they already know everything. So they polish the appliance really nicely, they bend the wires nicely, but they don't understand the principles of general dentistry. So this is a two professions, and only Dr. Wong was able to solve the puzzle because he's a general dentist and he did dentures that you need to use for chewing. So he knew how to redesign the appliance so you could eat with it and it would be non-intrusive. Orthodontists, we don't care. We throw things, and if they're intrusive, we'll just find a screw to make it permanent. But this appliance has to be removed for the correct activation of it. It cannot be fixed. And orthodontists, we don't like to remove things. We rather screw 10 screws in somebody's head than teach them how to manage an appliance. And the labs are the same.
Mm-hmm. Yeah. I think an interesting comment I can make is that Dr. Lipkin, who's my dentist, he's obviously an MSE provider and he's done hundreds and hundreds of cases. He's out in Westwood, New Jersey. He said that his success rate with the MSE increased dramatically once he started making them in-house in his own lab. So there does seem to be something about subtle improvements you can make to the appliance when it's totally in your control in your own lab. It does seem to be the difference between success and failure.